Thank you, Madam Chair, and it's a great pleasure to serve under your chairmanship today, particularly on this day when I'm very aware that there are other events going on in Parliament, and I'm grateful to colleagues who've come from all parties to support this debate, and to the Minister on what I know is a very busy day for his department as well. Madam Chair, today is a day to speak on behalf of the children of alcoholics, the children who suffer in silence around our country, of whom there are now, sadly, many, many more. Nearly 2.5 million children live with one or both parents suffering from serious alcohol dependency and abuse. And it's my great privilege, standing here today as chairman-elect of the All-Party Group for the children of alcohol, to be able to bring this debate and to formally launch our campaign across the House, both houses and all parties, for this Parliament to take forward the work of NACOA, the National Association for the Children of Alcoholics, brilliantly, if I may say, ably led by colleagues John Ashworth, Liam Byrne, who've now passed the baton to me, now that I'm no longer in government, as a freelancer, Deputy Chair of the Science and Technology Select Committee, and free to speak without fear or favour. And I can hear the Honourable Member saying I've always spoken without fear or favour, which is let me just start by saying that it may not surprise you, Madam Chair, to know that there are actually many children of alcohol in this great Parliament, because for many children it's a terrible trauma of silent suffering from which they never really escape. But it also drives in many children an extraordinary ability to take on responsibilities too young, to take on tasks and duties that really only fall to adults. And it often engenders a drive to make a difference. And when you see 10, 11, 9, 8-year-olds having to cope with things that nobody should have to cope with, let alone a lonely child carer, it's not surprising perhaps that much of the drive that lies behind many people in this Parliament comes from some of those experiences, whether of alcohol or other addictions. I'd be delighted to give way.
Madam Chair, can I commend the Honourable Gentleman? I spoke to him, and some people have lived it, and the Honourable Gentleman will refer to that, and I'm very moved by what he has told me beforehand. But across Northern Ireland, there are some 40,000 children living with parental alcohol, and there's been a rise in specific alcohol deaths over the same time. Does the Honourable Member agree that there must be more focus, and there should be introduction of routine antenatal and health visitors screening for parents dependent on alcohol to enable the support that the parents need, but also to ensure that the children are protected in the home? I've a friend I grew up with, Madam Chair, and I always remember that story. It's stuck in my mind all my life.
I'm very grateful to the Honourable Gentleman, and yes, I do agree. And I want to reassure the Minister I'm not here to hit him with 20 demands. I mean, that will come in due course, but today is really a chance to raise the flag for the All-Party Group, and that is one of the Honourable Gentleman's mentioned one of the things that is in our manifesto for change, and I'm grateful to him raising it. Of course, I'd be delighted to give way.
I'm really grateful for all that the gentleman does in this place, but I wanted to raise the issue about fetal alcohol disorder. We know that the prevalence now is at 4%, higher than autism, and indeed, as the Honourable Member mentioned just previously, there is no screening programme for pregnant women, and it's really important that we have an understanding of the issues and we find a sensitive way through to protect those children from developing such a disorder.
Well, I'm very grateful to the Honourable Lady for that. She makes another excellent point, and as the Minister I know and his department will understand, not only is there no magic bullet, but many of these issues circulate and form secondary complications that cost, which is the least of it, huge amounts to the health system later. And I'll touch in a moment on some of the mental health issues that, in many ways, in our society, 80% of us are reasonably lucky. 20% of our society struggles to escape these very, very difficult syndromes related to either living with addiction or suffering from mental health. Many of our prisoners are people who are still suffering. They're prisoners, actually, of mental health and addiction. And many of our children are born to parents who had no chance to give them the start in life. So there's a circularity here which actually drives a lot of underlying health conditions and predispositions and comorbidities. I wanted, Madam Chair, just to make the point, without indulging my own backstory too much, that this affliction knows no class or geographical boundaries. When I first joined the All-Party Group back in the coalition, as a newly elected Conservative MP, I went with some trepidation because it was very proudly led really by Labour MPs pointing out that poverty is a major cause of addiction and alcohol, and they're right. The point I made was, in addition, it is also a curse that goes across our society. And I was very lucky to have one of the most materially privileged childhoods, packed off to the greatest schools money can buy and given all the material support. But as a child in a family of 2 alcoholic parents, in the end it doesn't matter. Because if you're suffering that experience, you're lonely and you're on your own. And I acquired at a very young age a habit of spotting which adults could see below the line. And what I mean by that is those adults who would look at an 8-year-old and see what was going on and just quietly acknowledge and say, "And how are you, young man? Things can't be easy," which is all you need as a child, to know that somebody has spotted. Children are very loyal. The last thing they would ever do is dob their parents in. In fact, quite the opposite. Many children end up having to lie for their parents to get them out of difficult situations. Those are habits that no child should really learn. But the thing I learned most of all was that there are 2 types of adults: those who understand, who look, who acknowledge, who see, and those who don't see below the line. And that isn't shaped by class or geography at all. And it's the same in this House. There are colleagues who really understand and feel the importance of children who don't have a voice really in here unless we speak for them. So I'm really rising today to speak on behalf of all of those children, wherever they are, whoever they are, from whatever background they come from, to let them know that we are listening. This Parliament is here to speak for them as well. And the fact that they don't vote, and the fact that they may feel silent, and the fact that they may feel unheard, it is not the case, and that there are many of us here who do understand and want to help them. You probably know, Madam Chair, and colleagues may know, a child of alcohol. I say that because very often people say, "No, I don't." Well, we probably do, because there are over 2.5 million children now, sadly, in this country who are living not with parents who drink a little bit too much. That probably applies to many of us. But with parents, 1 or 2 parents, with a serious alcohol dependency problem. And sometimes in our society, I think we forget, because alcohol is part of our cultural history, and it's something we've come to live with and accept, and in many ways encourage as part of our society. But I think that often means that we forget the difficult consequences for the children who live with the aftermath, whether it's of social drinking or binge drinking, or the habits that alcoholics acquire, the habits of deceit, the habits of often forgetting what it was that they said or did, the habits of unintended consequences that undermine their ability to parent and then lead to children normalising those behaviours. So I'm rising to speak for those children wherever they are and whoever they are. I'd be delighted to give way.
I thank the Honourable Gentleman for giving way. Alcohol was a very prevalent part of my childhood growing up. I was very fortunate that I had grandparents who were able to step in at times when it was necessary, but I will never forget. And it was the fear of knowing that the pubs had just closed and that my parent would be coming home in a horrible state to disrupt what would normally be a very productive and pleasant household. And I think sometimes those are things that children take away with, and as I remember, and cannot get away from. And then it's the impact that those experiences have on our relationship with alcohol, to the point now that it is not something I enjoy, it's not something I particularly partake in, simply because my memories have been formed by those experiences at a very young age. And whilst I was lucky to have my grandparents, you can't get away from those memories.
Well, I'm very grateful to the Honourable Member for making a powerful, personal and political point. He's right, he's absolutely right. And for my part, Madam Chair, people often ask me how on earth I ended up in this place. The truth, actually, my mother, who went on to become an alcoholic, tragically, my father had been an alcoholic and she suffered terribly through that. And it's her funeral on Friday. She asked me, after I was elected, when did you decide that you wanted to be an MP? And I said, well, actually, Mum, I came on a school trip aged 10 or 11, and like schools do, and wonderful to see children coming in. And nobody in the class, nobody knew that I was then a solo child carer of an alcoholic parent, dealing with the things that those children do. And struck by the thing that I was living with was the fact that there seemed no one I could turn to. There seemed to be no network of support, no one could raise it with. One was on one's own. And I walked into the chamber of the House of Commons, in which we have the privilege to serve, and was electrified, literally electrified by what struck me, the fact that there is a place where the nation tries to take responsibility for itself, where people are elected to take responsibility and actively seek that responsibility, which to me was an electrifying idea. And I remember I was the least prepossessing boy in the class. I was the smallest boy with a mop of red hair, a very bad stammer, crushing confidence issues, and a double brace. I was the least likely boy in that class to become a parliamentarian. And I remember walking into the chamber and seeing the sign saying, "Don't touch, don't sit down, don't," and looking at the dispatch box and staring at it. It was at my eye height. And I remember my teacher behind the speaker's chair saying, "Stop dawdling, Freeman, keep up." I said, "I'm not dawdling, sir. I'm intrigued because it says don't touch, but someone's been touching, as the minister will have touched, the corner of that dispatch box. The sweaty corner where nervous ministers being cross-examined, I now realise, having had the privilege of doing it, are being forensically held to account." And he said, no, that's not the public. That's where ministers hold on when they're being cross-examined. And I was electrified by that idea. And I left the chamber thinking, what a place. So if we can give the children out there who are suffering some confidence that we are here for them and that we're listening, I think we'll be doing them a great service, and also this Parliament and our democracy a great service too. I want to make a point, Madam Chair, about the geography of this, because I think sometimes, as with so many social malaises, we think of it as an inner city issue. And indeed, many of the formulae the government used to allocate money, actually, they're largely driven around inner city formulae, shaped after the inner city riots of the 80s. I used to be a specialist in local government finance for my sins. And when you look, a lot of those formulae they allocate money to areas that have high-rise flats, high incidence of non-ethnic families, all important indicators of certain types of deprivation. But actually in rural areas, in many areas that don't fit those qualifications, there are many social issues as well that are often hidden. And in rural mid-Norfolk, an area people drive through on the way to the most beautiful coast in the land, behind the hedges and behind the beautiful villages, there's a tidal wave of mental illness, of depression, of suicide, of farmer a week taking their life, of children suffering. And I think often we overlook that rural dimension. And that's equally true of mental health more broadly. And that's why, Madam Chair, I last year set up the Regeneration Theatre Company with my wife to take her inspiring one-man Hamlet, made by her ex-husband, a former alcoholic who's been to prison and been on a journey now, and we're taking it round prisons to help connect with prisoners and to help them understand that many of the traumas they've experienced are actually to do with addiction and to do with the behaviours that go with it. And I'm grateful to the Prisons Minister for his support. But today is really about the children of alcohol, and I wanted particularly to pay tribute to NACOA, the National Association for the Children of Alcoholics. Colleagues will know there are many all-party groups in this great palace. Rather fewer than there used to be, which I think is probably a good thing. There were ones for jazz, teddy bears. I think there was an all-party group for Brideshead Revisited at one point. They're now, those light, frothy, frivolous all-party groups have gone. They're generally now very serious groups committed to those issues that don't lend themselves well to individual party politics and to causes that often get lost. And it's been my great privilege to chair a few. I have to say, the all-party group for the children of alcoholics is the most extraordinary I've ever seen. The meetings are packed with 100, 200 people. We hear from children who come to Parliament to speak about their experiences. We hear from very high-achieving adults who are still dealing with the damage of their experiences. I draw in particular, I've mentioned Callum Best, whose father, George Best, was one of the greatest, if not perhaps the greatest, and a Northern Islander to boot, I believe, footballer in this land. Funnily enough, my mother met George Best at a drying out clinic 50 years ago, and Callum is an inspiring advocate for this cause. And I wanted to pay tribute particularly also to Hilary, Piers, Amy, Maya, and all of those who volunteer to give their help to support the children who, without them particularly, would have no voice. And a shout out to Camilla Tomini, who's also been a great supporter of our work. And we do have supporters in the House of Lords as well. And I'd make the point that sometimes I think people think that privilege comes with a disconnection from some of these ills. People might be surprised to know how many people there are in the House of Lords who've suffered as children of addiction of all sorts. So this is not an issue that lends itself to partisan or single party or single geographic advocacy. I wanted to welcome the Minister. It's the first time we've had a chance to engage like this, and I congratulate him on being the Minister for Life Science, a role that I was lucky enough to be the first holder of, and it's great to see him in his place. And having served in his department, I know how many difficult issues he has to deal with, and that department has to deal with, and there's no silver magic bullet for any of them. But over the course of this Parliament, what we're going to try and do as an all-party group is to set out a manifesto of reasonable, deliverable, fundable, understandable and relevant reforms that we hope the government would be able to work with us on. We don't suggest that the government's the only body that can deal with this. It requires a culture change, and it requires a broader network of support to help the charities, to help the community groups, and to help those on the ground in the communities where so many children are suffering in silence. I won't go through today, Madam Chair, or Minister, the list of issues in the manifesto, and I'll save him the duty of having to read out the speech that his officials have probably carefully written, going through point by point. But I wanted simply to ask, if I may, if I could lead a delegation from the all-party group to come and see him and officials in due course in the department when we've got the group formally constituted, to run through that and to talk through what else we might be able to do to help these children. I want to give the Minister a chance to respond, so I won't detain the Chamber any longer, Madam Chair, other than to say that if we can all keep in our minds that there are 2.5 million children out there who today, now, are watching the bottles, watching the levels, keeping an eye on their parents, distracted from their schoolwork, struggling to do all the things that children should do, learning to normalise anxiety, and learning a lot of habits that will stay with them. Some extraordinary tenacity might serve them well, but many will also cause them long-term problems. And I think if we can grip it, we'll be able to do a lot for long-term public health as well. I'm grateful to the Minister and to you, Madam Chair, for allowing me this debate. Thank you.
The question is that this House is to consider the matter of children of alcoholics. Minister Dr Ahmed.
Thank you, Ms Harris. It's a pleasure to serve under your chairmanship. Can I start by congratulating the Honourable Gentleman, the member from Mid-Norfolk, for bringing forward this important debate, particularly in what must be an unimaginably difficult week for him. And I think I speak for all of us when I say we send him our love as well as our sympathy this week. And can I also thank my honourable friend for Stoke-on-Trent Central for sharing his powerful personal story, and thank the thoughtful contributions of the members for Strangford and York Central. And I'm very happy, once the APPG is convened, to liaise with the honourable member, with my friend, the Minister of Public Health, to see if what form of meeting can be arranged for that APPG. Madam Chairman, alcoholism is an absolute tragedy that blights communities across the United Kingdom, including in my own constituency of Glasgow South West and the west of Scotland, where I've seen it as a medical doctor practising for over 20 years, including in some of my own transplant patients that have arrived and crossed my operating table. And as much as I love my job as a surgeon, I would love nothing more for those transplants to never need to happen again. I want to reassure colleagues that this brief doesn't just sit with my honourable friend, the Minister for Public Health, but sits with all ministers across government who are rightly focused on raising the healthiest generation of children in history. And while we want to support children whose parents have alcohol problems, we also want to support their parents to get better too. While not all children of parents with an alcohol problem will experience harm, they are clearly at far greater risk, and far too many children will have, as we have already heard, have their childhood scarred by their parents' drinking. In 2024-25, 14% of child social worker assessments cited parental alcohol use, and in 23-24, alcohol or drug use was identified in 43% of child safeguarding practice reviews. where a child was seriously harmed or sadly died. Children are growing up in these environments are more likely to face additional challenges such as parental mental health problems and also, unfortunately, domestic abuse in certain occasions. And the trauma from these experiences can last well into adulthood, meaning the cycle can repeat and the trauma is passed on through multiple generations. That is why we must do everything we can to break that cycle. Madam Chair, alcoholism, as we have heard, can affect anyone, but it does at times hit hardest in some of our deprived communities. And that's why from April next year, this government is rolling out Best Start family hubs to every local authority. They will provide a high-quality service for parents and focus on early child development and digital resources to facilitate this. Hubs will be open to all and based in communities where alcoholism is most prevalent, ensuring that services will reach the children and families that are likely to benefit most. This government is also confirming that we are giving vulnerable families and children better access to local support services. Our strategy is based firstly on breaking the cycle of late intervention and secondly helping more children and families stay safely together as a unit. And we're doing this through the national rollout of the Family Help Multi-Agency Child Protection and family group decision-making reforms delivered through the Families First Partnership Programme led by my right honourable friend, the Secretary of State for Education. The programme's funding amounts to £2.4 billion over the next 3 years. And to help identify vulnerable children and families affected by parental alcohol problems who need a helping hand, my department will be supporting local authorities through an additional range of resources, including local prevalence and treatment data being available and child safeguarding guidance for alcohol and drug treatment services. Madam Chair, we're doing this for children and their families. But we must also target our support to make a sustainable difference to pregnant women with alcohol problems. Timely and effective treatment is key because drinking in pregnancy leads to long-term harm for babies. For example, fetal alcohol spectrum disorder, as has already been highlighted in this debate. The more women drink, unfortunately, the greater the risk. That is why the UK Chief Medical Officer's guideline is that if a woman is pregnant or thinks she may become pregnant, the safest approach is not to drink at all. Now, it's a genuine tragedy that pregnant women and mothers with alcohol problems are sometimes the most stigmatised and harshly judged in our society. That means it is incredibly difficult for these women to speak out about their issues and to let services know that they have children. This is preventing women, children and families from getting the help they deserve. We cannot forget that many women who drink during pregnancy as well are coming from homes where their own parents were dependent on alcohol and are often at the sharpest end of not only inequality but complex and multiple other needs. Many of them have been victims of trauma and abuse in their own childhood. That's why this government is committing to reducing stigma, improving the quality of treatment and making support available to every woman who needs it. First, we are piloting local approaches to reduce stigma among doctors, nurses and other healthcare professionals. But secondly, we will soon publish the UK's first clinical guidelines for alcohol treatment that include advice for supporting pregnant women and parents in stopping or slowing down safely their alcohol use. And thirdly, the Department of Health and Social Care and NHS England are finalising co-occurring mental health and substance use delivery frameworks. This will outline commitments that we are setting to improve integration of alcohol and drug treatment with mental health services at a national level. And fourthly, we are planning to publish guidance on how treatment providers can better support and improve service provision for women. We'll be working with local commissioners to ensure that they consider the specific needs of pregnant women and parents in their drug and alcohol treatment commissioning plans. We are also continuing to invest in improvements to local alcohol treatment services, which faced significant cutbacks previously through a decade of a disinvestment that followed. Just last week, the government announced an investment of £13.4 billion, or a 5.6% cash increase over the next 3 years in local authorities' vital public health work through the Consolidated Public Health Grant. This includes overall £1 billion of drug and alcohol treatment and recovery improvement grants over the next 3 years. But treatment, Madam Chair, alone is not enough to improve outcomes for our children. The The evidence suggests that alcohol treatment combined with support to help parents raise their kids can increase the likelihood of recovery from alcohol dependency and reduce the risk of child neglect or abuse, and crucially keep families together. Madam Chair, I'm grateful for the opportunity to speak and respond to this debate. It's given me the chance to outline how this government is laser focused on improving outcomes for children from all kinds of backgrounds who find themselves in these situations, born to parents who suffer from alcohol problems at no fault of their own. I hope I have demonstrated that our approach is not based on stigmatising, but on keeping families together. That's why our strategy is based on Best Start for Life hubs and the Families First Partnerships programme, so we can make sure I turned off my phone. But sure parents and alcohol treatment services also receive vital parenting and family support. The Department of Education has released some statutory guidance calling working together to safeguard children. I would like to pick out one phrase from that guidance. Nothing is important than children's welfare. That couldn't be more true, and everything we're doing across government is aimed at improving children's health and protecting child welfare, so each of them can thrive in a loving and safe and stable home. And if I can end by speaking directly to the member. He has spoken today not only in this place, but to the nation. And in doing so, he has ensured that more members and citizens of our nation will now look, will now acknowledge, and will see below the line, so that together we can ensure that more children do not continue to suffer in silence.